Thank you so much for coming to the Community Outreach Day 2020 press conference. Today we're going to talk about all the accomplishments we had on Outreach Day and everything that you guys accomplished. My name is Haiti DeAngelis. I'm the Student Pharmacist Council President. I also have with me today Jessica Severin, the APHA ASP President, and Miguel Lopez, the ASHP SSHP President. So when we started planning Outreach Day this year, we knew it was going to be a different Outreach Day than ever before. So back in May, we were thinking, what do we have to do that's different? And we need to make sure it's COVID safe, and we definitely want to serve. So we started at the drawing board, and we thought, we're going to need to make smaller events and still get as many students out there as possible and serve New Mexico to the best we can as pharmacy students. So this year, these are the services we offered. We had immunizations. Immunizations were different this year because normally immunizations occur in large settings where we try and get as many people as possible to come and get their shots all at once. Well, this year we ended up working with lots of community pharmacies throughout the city and sending students in pairs to different sites. All of our other initiatives got to adapt their normal services so they were COVID safe. They were doing things where they used to be trying to go to high schools and middle schools and engage hundreds of students all at once. Now they're going to Google into the Google classrooms to engage students. Some of our sites, or some of our initiatives also created videos that could be used for years to come to educate the community. This year we additionally got to work with some new initiatives. We worked with the COVID-19 hotline and with Tricor. We also worked with Roadrunner Food Bank. We always enjoy working with Roadrunner Food Bank, and this year we're really glad we got to work with them. A lot of our P1s got to go to Roadrunner Food Bank this year. We also knew that there were going to be a number of students who weren't going to be able to engage the public at all or even work in small groups, and so we needed to offer a completely remote way for those students to serve, and that we did with the community service donations options. This is a map of all of the 2020 sites this year. We had 35 sites across Albuquerque and one in Edgewood. Of those sites, 23 were community pharmacies, and those were where students would go in pairs to help the pharmacists there immunize as many patients as possible. There were 7 middle and high schools, 3 Tricor sites, and that was one in Edgewood, Roadrunner Food Bank, and the COVID-19 hotline. And we also had a few students recording videos here at the College of Pharmacy that day. Jessica, Miguel, and I, and Jose got to drive around on a bit of a tour of Albuquerque that day and try to see as many sites as we could to encourage the students, engage with the pharmacists there, and just see how Outreach Day was going. And everywhere we went, the students were being extremely productive, especially at the pharmacies, and giving tons of immunizations. I got my flu shot that day, actually, and the pharmacists were extremely thankful to have students there helping them out. The COVID-19 hotline, the phones were ringing, students were answering calls. It was great to see that. It was really cool to see a couple of the Tricor sites too, and how they're trying to utilize pharmacists in those locations, and hopefully going forward there's going to be even more opportunity there. Some highlights this year for Outreach Day: we developed online trainings for all of our initiatives. So normally, you guys might remember, at the beginning of the semester, the very first month, there's a blitz of trainings where students have to come to campus early in the morning, late at night, in like every common hour, and go to trainings so they can be trained for the initiatives to serve the community. Once students are trained, they're definitely ready for Outreach Day, but they can also be trained to serve throughout the rest of the year in lots of different opportunities. Well, COVID wasn't going to allow us to do our normal in-person trainings, so all of our chairs rose to the challenge of developing online trainings. And the online trainings were actually really well done. We really enjoyed them, and they worked really well. We're probably going to keep using them in the future, or maybe do a hybrid online in-person training. We also knew that online trainings might mean inundating your emails with hundreds of emails about when to be, where, and whatnot. We did not want to do that, so we worked really hard on developing a website to house all of the online trainings. We ended up doing an internal website, so just for the students to log on, learn more about the different initiatives, decide which ones they want to be trained for, and train for them online at their leisure. And a lot of them had quizzes at the end where they could get certified. that they were officially trained, and then there was often follow-up with the chairs so the chairs could really determine that the students were trained in their initiative and ready to help serve. We also had an interview with KRQE a couple days before. Jackie and I got to be on TV and talk about what pharmacists were going to do, what student pharmacists were going to do on Outreach Day, and that was really something. I didn't think much of it because I never watched KRQE as, you know, a 20-something, but a lot of people do. People, I really was surprised. I got emails from people I hadn't talked to in years from work, or my great aunt's best friend recognized me and called my aunt, who called me and said, "I saw Edie on TV, what is she doing?" And it was a good opportunity to talk about what pharmacy students are doing in Albuquerque. Miguel also had an interview with KRWG in Las Cruces. And that's just really good publicity for how pharmacy students can serve our community. And lastly, we did all of this with COVID-safe practices. Most of our planning was occurring in September and early October. And at that time, you might remember the governor's ordinances were to have groups of no more than 10. So a lot of our plans were relying on about 10 people at a time. Well, the day of Outreach Day, the rules are going to change and the maximum group size is going to be 5. So we had to adapt pretty quickly and break apart the groups, send people to more locations. We were able to do that in no small part because of all of the initiative chairs who had been helping us, and all the pharmacists around the city willing to take us in to their pharmacies for the day and have us help them. So we were able to do all of this with COVID-safe practices. These are the numbers. Take a minute to look at them. They're pretty impressive. Community members served by pharmacists and some pharmacy students in some way that day. And the numbers kind of built up year after year. They got a little bit more and a little bit more. And then you have 2020. We knew the numbers were going to be smaller this year, but 3,232 is a number we are incredibly proud of. You guys did so much work to serve this many individuals in New Mexico this year, and during a pandemic. It's impressive how many people we got to serve throughout all of these challenges. And you can see on here the immunizations, 1,200 immunizations done at Walgreens and CVS across Albuquerque. Most of them were flu shots, but this year we actually got to do a lot of non-flu immunizations too. We got to engage with hundreds of students in classrooms online. You can see on the bottom the COVID hotline. There were 647 calls answered by pharmacy students on the 2 days that they were serving at the COVID hotline. Almost 150 patients were screened at tri-court sites. A couple of these are TBD, to be determined. Now, those are hard numbers to estimate how many people the Stand Together Geriatric Initiative and Diabetes Family Education are actually going to serve based on the work they did on Outreach Day. Those two initiatives developed videos. They produced videos on Outreach Day that can be posted online and be used to engage the community for years to come. Stand Together worked on things like sizing and picking proper walkers and canes. Diabetes Family Education created videos to help individuals who have loved ones that have diabetes, help them learn to manage their conditions. It's really impressive. These videos look fantastic, and these initiatives are working really hard to work with the city of Albuquerque and other locations to put these videos online so they can reach the most number of people possible. So future directions, what are we going to do next? Outreach Day 2020 is officially over, but we still have a little bit of work to do. We want to have a group discussion to discuss what went well and what could be improved for future years. This will benefit not just Outreach Day next year, but also how to maintain community service throughout the rest of 2020 and into 2021. We also want to build upon the new partnerships we had with Walgreens and CVS. We've definitely worked with them before on Outreach Day, but this year we worked with them so closely and it was very beneficial to them and to us. So we want to keep that alive and keep working with them. It was amazing to work with TriCorp for the first time ever on Outreach Day, and I know they're looking at ways to utilize pharmacists even more. So we're hoping to help them do that and be a part of it in whatever way we can. and the COVID-19 hotline. As long as COVID is here, we're glad that we can have pharmacy students help. And I hope that the training we did to train the dozens of students on Outreach Day who got to help can be used as connections to help with the COVID-19 hotline going forward. And even after that, when it's back to the poison control, that they can, the pharmacy students can still be helpful there. And we're also going to apply for grants, so that way we can, if we receive the grants, we can make the impact that student pharmacists have even bigger on Outreach Day. One other thing we want to do is to develop an external website. We developed an internal website using Google Sites that was extremely useful this year, but we also want to work on an outward-facing website that we can sort of give to community members and say, here, go to this website, learn more about what student pharmacists are doing and how we can come help you. And it would be a way that the community can engage with student pharmacists directly to plan for Outreach Day events in the future, but again, to plan for service for the rest of the year also. And with that, I'll give it over to Jessica here. Thank you.
Hi, everyone. My name is Jessica Severin. I'm the president of APHA ASP. And I'm just going to talk today a little bit about how our chairs did such an amazing job adapting to serve in a pandemic. So one of the main things that Outreach Day has always been about has been getting out in the community and providing services to New Mexicans. So, of course, this year it did look a little bit different, but of course that didn't stop the students at the UNM College of Pharmacy. So our patient care projects were transitioned into a virtual format. So what would have been an in-person event was turned into a more of an educational event. So talking to high schoolers or middle schoolers about self-care and Operation Heart, Operation Diabetes, and things like that. Talking to UNM sororities about women's health and just really trying to engage the community in a virtual and safe way. So we did focus more on presentations and community education at this point, just because it's a lot safer for everyone, but it also makes a huge impact. So as Haiti had mentioned, we also had completely remote options in the form of donations. So at APHA ASP, we have an initiative called SPEAK. It stands for Student Pharmacists Engaging in Acts of Kindness. Our chairs are Ariana Sanchez, Jada Gooden, and Anna Capino. They did an amazing job setting up different nonprofits throughout town and setting up donation drives to serve those different nonprofits and allow for students who were maybe not comfortable going out in the community or just wanted to serve in a different way, that opportunity to make a donation and really make a difference in a way that we really hadn't had the opportunity to before. So really great job done on their part. Another way that we adapted, as was kind of mentioned, was our immunization sites. So instead of setting up different sites around town and around the state, we transitioned to a community pharmacy setting. So what exactly does that mean? We were set up at different Walgreens and CVS's around town, and we were set up in different shifts. So it was 2 students per shift per day. So it was a total of 4 students for the entire day at one store. Those students provided both flu and non-flu vaccines, which was something that we had never had the opportunity to do before in the past. And we had given over 1,200 shots this year, which is an incredible number. Pandemic or not, that is a huge number of vaccinations given. So a huge shout out to our immunizations teams and Walgreens and CVS for helping us to serve the community that way. The pharmacies also provided us with COVID safe practices. So in order to go to the pharmacies, we had to have it approved that they would have the vaccines, they would have to provide us with PPE. They also, most of them provided us with a socially distanced vaccine area, so they actually had set up a specific area for our students to safely give vaccines to the patients, which was an incredible thing for them to do. So thank you for taking such good care of us. So with that, that would not have been possible without Dr. Amy Beckeritz. She had gone so far above and beyond to help us make sure that we were all taken care of, make sure that we had sites, and make this day truly possible. So Dr. Backerts, thank you for helping us set up sites last minute and for making sure that students were safe while serving the community. Thank you for helping us become better student pharmacists and leaders. We are so grateful for everything that you do for us, and Outreach Day truly would not have been possible without you. We cannot thank you enough for everything that you did for us, both leading up to and after Outreach Day. So thank you for everything that you do and continue to do for us here at the College of Pharmacy. So some other things that we had mentioned were online trainings. So personally, the online trainings format was something that we had not done in the past, but it definitely can be utilized for something that we can do in the future. We kind of mentioned a hybrid method. It was a little bit more convenient to do things online, and the chairs really stepped up to the plate and did an incredible job of creating the same kind of training that you would get in person in a virtual format, just to make sure that everyone was safe. And with that, we had increased numbers of students that were trained in all of these initiatives. We had higher numbers than we had seen in the past few years. So it was a really incredible way to get all of these students trained in order to serve the community. So with that, we also rolled out a new technology this year called Smart Sheets. So Dr. Hunter in our curriculum office has set up this, her and Maggie Devlin have set up this tool to help us keep track of sites and preceptors and different things that we never thought we would have to keep track of, like will PPE be provided, how many students will be there, things like contact tracing if we needed it. So they made sure that all of our student leaders were trained in that, on how to use it, how to set it up for Outreach Day, and really made sure that we were able to utilize this online, completely virtual tool to help us keep track of numbers and all of these different things that we had never really had to keep track of in the past before. So with that, we want to thank Dr. Tracy Hunter. Dr. Hunter, thank you for your continued support of the students of the College of Pharmacy. You have made yourself completely available to us and supported us from the very beginning of this planning process. We cannot express how grateful we are to have you as a resource here at the College of Pharmacy. Thank you for always putting students first and for helping us make Outreach Day such a success. We could not have done it without you, and thank you for everything you continue to do for us. So with that, I will go ahead and pass it along to Miguel Lopez, who is the president of ASHP, SSHP, and he will go ahead and give us a debrief about some of our newest initiatives from Outreach Day 2020.
Hey everyone. I just want to say again to the chairs that made all this possible, thank you. I didn't really do as much as you guys did behind the scenes to get everything set up and working, all the moving parts. So that's my first goal, is just to really let you guys know that the chairs of these initiatives were the real people to thank in this. So some of the newer initiatives that we had, due to like COVID, we had to explore other options. I reached out to TriCore, and during TriCore, we were able to survey patients going in for routine labs. And this wasn't for like a COVID testing. This was just, gaining access to, labs for patients. It's been very challenging for patients to go see their primary doctor. There's just been a lot of struggle with patients being able to get into their doctor's office. So having a site like TriCore offering those really valuable lab drawings and was just phenomenal to see students in action, surveying patients, engaging their interest in expanding services. So this was a new partnership, and we hope that to continue that in future years. And we just really want to thank Dr. Monique Dodd. So thank you so much for helping us adapt to the challenges of COVID-19. This was the first year that we have collaborated with Tricor, as I said, and we look forward to collaborating in the future and presenting fellowship opportunities to students. So fellowship is something that we could definitely learn more of, and having a site like Tricor would really help us reach students and let them know what opportunities are available out there. So I think Tricor students surveyed about 160 patients that day, so that was really nice numbers. So next, in figuring out ways to serve the community and how to reach the community in a safe way, Dr. Susan Smolinski, who already runs the Poison Control Center here in Albuquerque, had to scramble when COVID-19 happened and set up a COVID-19 hotline. And this was to bridge resources to the community and get them their test results. And so patients had a way of calling in and just finding out where to get resources, kind of a transition of care, which is really important during this time where people were just kind of making things up and on the fly, and just being able to reach the community in a meaningful way. So the COVID-19 hotline is a pharmacist-led initiative. There's nursing students, medical students, retired nurses that go and volunteer their time. But we also have a lot of pharmacy students that work there and donate their time. And so that was one of our favorite sites, riding around that day on Outreach Day, visiting the COVID-19 hotline and seeing the impact. Between those 2 days, students took 647 calls, which is amazing. And these are patients that don't know what to do, what the next steps are. So they get them to resources like that the Department of Health has to offer. And it's just a really inspiring way of how pharmacy students and how students in general are able to make an impact in their community. So with that, I really want to thank Dr. Susan Smolinski for her leadership in setting up the COVID hotline. Her and her team did an amazing job. So you continue to show the integral role that pharmacists play in the wellness and safety of our community. And it was really great to see the team in action that day. Also, I want to thank Gardenia Gomez and Mariah Lucero, who work at the COVID hotline, but they acted as initiative chairs. Like, they kind of took this project on and ran with it. They coordinated with Dr. Smolinski to finalize the training for students, and they were able to set everything up in a really quick manner. They jumped at the opportunity. I think it kind of goes back to the service part of it, just wanting to make sure that we're reaching as many patients as we can during this time where everyone may feel isolated and not know where to turn for resources. So just their effort in making this a reality for Outreach Day was really inspiring, and we hope that students will continue to take advantage of these opportunities to reach out to the community and volunteer their time with the COVID hotline, because they could definitely use the help. That's all I had, but again, I just really wanted to thank everyone that made this a success. I'll turn it back over to Haiti, and we'll wrap things up. Thanks, guys.
Thank you, Miguel. So now I get to do the marathon of thank yous. I mean, there's so many people who helped us on Outreach Day that I have to thank everyone. So here I go. First, Dean Godwin, thank you so much. You had unyielding support and unlimited faith that we could do this year, and it was very encouraging to hear from you. Anytime we would check in with you or ran into problems, you would help us troubleshoot it, and just knowing that you knew we could do it was really something, and it meant a lot to us. Crystal, thank you so much. Every time we ran into a problem, every time the governor's rules changed, we knew we could come to you and you could help us understand what our options were. And again, you were just so supportive of us that we really appreciated that. Dr. Anderson, you came on Outreach Day and met us at a Walgreens because you needed to see the students. And knowing that we had a professor who wanted so badly to see Outreach Day in action was also really motivating for us. So thank you so much for coming and for your support throughout the whole process. Dr. Melanie Dodd, it was great to see you in the Aspects of Patient Care Lab, helping the STGI create that video. It was extremely encouraging to know that you're such a good mentor for that group and you were there to support them and to support us all on Outreach Day, so we really appreciate that too. Maggie Devlin, you helped us with the smart sheets, and as we go forward in trying to really build this website, we're going to continue to need your help, and so thank you in advance, and thank you for everything you did for us for Outreach Day 2 this year. Jose, thank you so much for everything you've done for us. I can say that on Outreach Day, riding around in a little red race car, Miguel's car, with the four of us was extremely fun. You were an encouragement to everyone you saw that day. You took some amazing pictures, which are just going to be great to look at, and for advertising and everything else we can use these pictures for. The backgrounds for all of these slides, actually this whole slide set looks amazing thanks to you. And I can truly say that after Outreach Day and riding around in the car with you all day, I've got a new friend, and I'm really glad for that. Also got to thank Mark Rudy at the office here at HSC who helped us get interviews on TV. That was extremely helpful, and you did a great job doing that, so thank you, Mark Rudy. Dr. Jeff Bettner and Jennifer Ortega and all the Walgreens pharmacists, thanks for hosting us and for just allowing us to come with you to partner with you on Outreach Day and give as many shots as we could. And again, Dr. Gavin Perlman and all the CVS pharmacists, same. Thank you so much for partnering with us, and we hope in the future. Dr. Lisa Anselmo and all the UNMH residents. I mean, we go into Outreach Day every year and we need the residents to sort of act as supervising pharmacists at all of our sites. Well, this year we didn't need very many supervising pharmacists because, well, they were already at a Walgreens, so there was a pharmacist there, right? But we got an email about the week before Outreach Day from Dr. Anselmo who said, please, my residents really want to help you guys on Outreach Day. Is there any way we can still partner together? And we made space because the residents and Dr. Anselmo were so passionate about helping us on Outreach Day. It was very encouraging to see UNMH residents there alongside our pharmacy students giving flu shots at various CVS and Walgreens throughout the city. So thank you, Dr. Anselmo, for reaching out and continuing that partnership. Have to thank Roadrunner Food Bank. Every time we work with Roadrunner, it's super easy, we get a lot done, and it feels so nice to go somewhere and serve the community, helping them deliver food to as many people as possible. Thank you, Roadrunner, for being very flexible with us and accommodating our 40 students that day. Have to thank APS. Again, like every year we partner with APS, and every year APS welcomes us and is happy to see our pharmacy students there teaching their students. So thank you, APS. Have to thank all the chairs and co-chairs for APHA and SSHP, as Miguel and Jessica already did. But thank you guys again. This was your project. You did all the hard work for this. So you guys did amazing, and thank you, thank you, thank you. I have to thank all the faculty and staff now. I mean, anytime you talk about Outreach Day at the COP, everyone knows what you're talking about, and they're extremely supportive. And I love to give updates to professors on Outreach Day because they're just so encouraging when they hear what we're doing. And staff is the same exact story. So thank you, the entire COP faculty and staff, for your support. All the students, not just the chairs, but all the students who actually came on Outreach Day and served. Just about every P1, 2, and 3 served, a handful of P4s. Thank you guys so much for your the work you did that day. We impacted the city in a huge way, and I'm extremely proud of you guys, so thank you. And finally, to everyone else, all the people we served with that day, thank you. And with that, I can go to my last slide here, and we're going to now transition to more of a Q&A style. So give us a couple minutes while Jose tinkers with the settings, and we can hear from the dean and a couple of the others online here. All right, now we're going to hear from Dean Donald Godwin.
Hey everyone, I'm going to be real brief. I just wanted to again thank everyone who participated in Outreach Day. I had absolute confidence in the students, the faculty, and the staff. I always do. I think you guys are the best in the country. I would put up our faculty, staff, and students against any in the country, and I tell other deans that all the time. It's actually ironic because today I got an email from the Health Sciences Center, and it's time to update our first quarter for our strategic plan. And one of the tactics I'm responsible for is all the deans really are is to increase the community engagement for the Health Sciences Center. So you can bet I'm going to be bragging on all you guys and use all the information that was presented in this town hall to really show what the College of Pharmacy does and the impact they have. So again, thank you very much. I look forward to hearing the rest of the Q&A, and I can't wait till this live broadcast gets recorded on our website, on our Facebook page, so other people around the country can see this. So again, congratulations, well done, and that's about all I can say. Thank you very much.
Thank you so much, Dean Godwin. And I see that Dr. Monique Dodd is online. We'd love to hear from you and how you thought the students did on Outreach Day. And yeah, if you've got a minute, please unmute and talk to us.
Amount of work, you guys. This was incredible what you guys all put together, and it was to the success of the College of Pharmacy. So thank you all for, one, giving us the opportunity to participate, and two, for just all the patients that you reached out to on that day. So yes, we had a great time. I think the students that were with us, we received some feedback. They told us they had an awesome time. It's something new, something innovative. And as you all had mentioned, our goal is to expand our services. And that's really what the survey was about. We know that during this time of COVID, our patients are fearful of going to all these different places and lobbies and waiting for their health care. So really, from our standpoint, we know that phlebotomy services can't go to every patient's house. And actually, one of the survey questions, which we found very interesting, was how comfortable do you feel coming to the draw site to get your blood drawn? And a majority of patients said they were very comfortable and comfortable coming. So we know that they feel comfortable coming there. We're making a great environment for them to have these, one-on-one engagement with the phlebotomist, and they need this care. So what we were doing with the survey is, what additional services can we provide here at TriCore draw sites so that it becomes more of a one-stop shop? And we're talking about vaccinations. So by time next year comes, we are crossing our fingers that we can begin providing vaccinations at our draw sites and have events throughout the state that we can also provide vaccines. So that's really what the students were helping us with. Again, they were able to engage the patient one-on-one, really interact with them, and create what I believe TriCore has created, is that nice one-on-one engagement. They know who TriCore is. They know the face of TriCore. They are now knowing the face of UNM College of Pharmacy and all of the students, all of your work. And I truly want to continue to support that. So thank you all. Thank you to all the students. Haiti, Jessica, Miguel, thank you so much for coming out to our draw sites. It was great to see you all. And thank you for the opportunity and supporting TriCore.
Thank you so much, Dr. Dodd. We look forward to seeing how this evolves going forward and to continue working with you. I also see Dr. Backeritz here. Dr. Backeritz, would you like to take a few minutes to talk about Outreach Day and how you felt it went, what was good, and we'd love to hear from you.
Sure. Can you hear me? Can you hear me? Okay, great. So Outreach Day was wonderful. The community pharmacists were sending me emails, text messages. The amount of work with immunizations has been a lot for us to bear in the store. And so having the students there just for that one day or one shift was extremely helpful. So we really appreciated it. All the students were professional. We had some hiccups at first with scheduling, but everyone worked together and it was a great collaborative. And I am hoping and praying that we will continue this going forward. Our community pharmacists could really, really use the extra help. So I'm really hoping that going forward, we continue with that collaborative inside the community pharmacy, serving those patients.
Thank you again so much, Dr. Becker. It's always fun to work with you and to learn from you. Well, that's it for our major programming here. Thank you all students for coming. It was great to see you guys online and show your support for Outreach Day. Initiative chairs who are listening, we've got a debrief meeting coming up too to figure out how we can keep this momentum going and continue serving our community for the rest of the year and for Outreach Days to come. Thank you all so much.